went in for a dental cleaning. And kind of prior to that, I had noticed some bleeding along the gum line on the lower aspect of my lower teeth. And it wasn't like a little bleeder that you get when you're flossing. It was a little bit, I knew something's not right. So showed it to my dentist. And he said, yeah, we probably need to get you in with an oral surgeon. Got it biopsied. And eventually it came back as invasive squamous cell carcinoma. So about a month from diagnosis, I had a 10.5-hour procedure. It was a left mandilectomy with a fibula-free flap. So in other words, they took my fibula from my right leg and reconstructed my mandible. And 9 months later, here I am. So I spent about a week in the hospital, 2 or 3 days in ICU, and then the rest was in a step-down unit. I would say my biggest challenge would be that my jaw is a lot of stiffness. So it's stretching that, because all this is muscle, and you don't even realize how much you use your jaw muscles. And I also had a neck dissection too, so that, all of this side was operated on. That and chewing. And I can only chew on one side right now. So I would say that was probably the hardest thing. And then, once you heal from all of that, then comes your next marathon, which is treatments. So I had 30 radiation treatments, and I completed those. Valentine's Day, February 14th, got to ring the bell. So that was a proud, proud moment for sure. The radiation team is absolutely phenomenal. But every single time they're like, come on, Miss Lynes, you got this. I was so thankful for them. So thankful. And even Dr. Hassel, who was my radiation oncologist, absolutely wonderful. Always available anytime I needed him, along with all of his staff, his nurses, his nurse practitioner. I mean, I just can't say enough about all of them. Truly, truly. My 2 surgeons, who I think we, Memorial and this area, are so very lucky to have them. They truly are just are craftsmen at what they do, especially what I feel like they did for me. To the staff in ICU, and the step-down nurses, there wasn't not one that I sometimes it's hard to find the words, but I'm so thankful for the care they gave me, and were just so encouraging, and came in and talked and were kind, when my family came and stuff like that. So I feel very, very lucky. I think I was right where I needed to be.